Hello, my name is Annie, and I completed my APEX with CHD Group, a global health organization founded in 2014. They are based in the city of Bangalore in Karnataka State, India. My preceptor was Dr. Edmund Fernandez, a public health physician and the organization's CEO and founder. CHD Group builds capacity within communities, implements corporate social responsibility projects, and provides technical support for health system strengthening. They also advocate with UN agencies and international governments. My experience was broad in terms of the variety of activities and projects engaged, but they more or less fall within three areas: survey analysis and development, communication design, and strategic input. I went to India during their monsoon. After some anxiety early in the year due to low reservoirs, intense rains came in mid-July and inundated several parts of India, including the northern state of Assam, for which CHD Group appealed for response funding. One of CHD Group's key areas is disaster management, and they organize health camps to assist the impacted. In addition to the obstruction of health services, some public health concerns after floods include the increased transmission of infectious disease and loss of food supplies and livelihoods. I analyzed 2 surveys from past health camps in Gujarat and Kerala states, and the results outline needs and public perception of preparedness and response. These results will be published and will help CHD Group advise partners and advocate for improved disaster mitigation. We often travel through the Western Ghats as well, a tropical mountain range influencing the monsoon, where degradation is interrupting its biofunction. This is salient as ongoing floods, drought, and water shortage, and other environment and health issues coexist across the subcontinent. India's health system is a 3-tier system adjusted according to the needs of the population. Unfortunately, health access is still poor, and basic public services such as clean drinking water and sanitation lack in the most vulnerable sections of the population. CHD Group develops public-private partnerships, providing technical assistance for implementation of government programs and corporate social responsibility. India is the first to mandate the latter, in which companies must invest profits in philanthropic and development projects. I drew from my background in communications and graphic design to help tell CHD Group's story and exhibit their project portfolio by designing their annual report, various graphics, a flyer specific to CSR and government partners, among other items. I also visited 2 tiers of the health system in Bangalore. At Winlock District Hospital, staff engaged us about the need for public health advocacy for overcrowded and under-resourced hospitals. At a primary health center, a leaky roof didn't keep this first contact center from serving about 65 patients daily. On the nutrition front, over 500,000 children need to be treated for severe acute malnutrition in Karnataka. With 10% of these requiring care from only 32 equipped facilities, CHD Group intervened in 5 northern districts where social determinants of health conspire for exceptionally high burden. The Ballery District Nutritional Rehabilitation Center has been in poor condition for months and is only at half capacity, even though 8 children were identified with SAM in the past week. These factors provide further impetus for CHD Group's ongoing advocacy and project negotiations. I was included in such health diplomacy interactions throughout the fellowship, and particularly in northern Karnataka, where it was established understanding and facilitated collaboration to improve conditions and programming as high as the district deputy commissioner level. These experiences altogether helped me engage my preceptor in a basic strategic planning process, the organization's first. Using a workbook I compiled from external resources, our conversations and situational analysis will guide further discussion among leadership for Plan 2020. This experience was insightful in many ways. Personally, I was coached on how to articulate my multidisciplinary skill set and how to balance planning and doing. I'm also thankful for exposure to field realities of health and determinants. CHD Group benefited from my design work, particularly since outsourcing can be costly, as well as my survey work. I also was able to provide feedback on the intern experience and suggest a program of readings, site visits, and other activities for future students. Barriers I faced were in navigating a new cultural norm for the office environment, mostly in adopting a more flexible and adaptable concept of time. Analyzing secondary data without a codebook was also hard, but this helped form the idea to explore automation options. My perspective on public health and global health has been greatly strengthened, and I've gained valuable insights into humanitarian health and diplomacy, which interests me professionally. My concept of public health also became much more inclusive of environmental and planetary health. One of the greatest lessons I learned transpired in attempting to manage a large volume of projects and idea streams under fluid schedules and timelines. This forced me to better prioritize tasks, focus my active mind, and essentially work smarter.